and that meant being able to generate sufficient resources from the operations of the organization or the program to do so. In the case of the Roving Caregivers program, I think the context of this program requires a redefinition or a review of the concept of sustainability. And in my view, I see it as the ability of this particular program to perpetuate itself.
Yes.
The focus of the program is the early childhood, the 0 to 3-year-old kids that are vulnerable. And I think we need to see the sustainability of that program in the context of the ability of a country or a government to be able to ensure that that program or the interventions that target these kids continue over a long period of time.
The success and benefits of this program are outstanding, and in a way, Dr. Didicus Jules, it's now positioning us to shift our approach to our focus on where we begin with a child's education.
A number of innovations that will help to make that possible, to make it possible for the program to expand and to deliver, particularly to the vulnerable in the Caribbean. But I think it's important to know that the seeds of sustainability have been there all along.
Yes.
What is unique about the approach being taken by the Caribbean Support Initiative in that regard is to look at the landscape and see that across the region, we have had traditionally, those parents who can afford to pay have paid for daycare and childcare, early childcare development activities. The state has, to a limited extent, done some provision. So a number of actors across the social landscape have already been investing in early childhood. What is needed now is a new thrust that combines all resources in a more holistic way to address the issue and paying particular attention to ensure that the most vulnerable, who are therefore at the most risk, are not left behind.
Mm-hmm. It's interesting, though, wouldn't you say, that most of the Caribbean has always focused on primary education, and this is now saying that we need to start a lot earlier. Do we have the kind of institutional framework or approaches, say, from governments, private sector, civil society organizations? Because if there is not enough knowledge on the ground about this reality, will people respond to what we are asking?
Well, I think that's a very crucial question. Traditionally, we've seen the school system as starting at the age of 5,
yes,
and going up to 15. And in fact, there's an expectation from the public that the government, the state, will ensure the provision of education from the age of 5. And what I think is that the research that has just come up in front of us and said to us, look, the kids between the ages of 0 and 3 are vulnerable, and it is critical that we intervene at that stage. What we need to do is to put this information on the table, on the public domain, and so that we can begin to see the role of the state and all roles in general as intervening not from the age of 5, but actually from birth.
Yes.
And I think that from the perspective of the private sector, even in times of depression such as now, continue, I think, to be very generous with their donations to a number of causes. But I don't think that this one is on the radar. And I think it's important that we begin to put it on the table for consideration. And I'm very satisfied that a number of private sector, corporate citizens and participants in the private sector will contribute to it.
Yes. The RCP definitely has the ability to cost-effectively educate young children and their parents by going directly into the participants' homes and communities. The RCP has provided opportunities that level the playing field for educational access, and this is very, very important in the Caribbean region. In each RCP country, there has been different levels of private and public sector support. However, the longevity of this program is now threatened, as the principal sponsor, the Bernard Van Leer Foundation, will be phasing out its support in the year 2011. Sustainability of the Roving Caregiver program cannot be underscored enough. Coming up in our next section, we will discuss the role of governments with the Roving Caregiver program. Do stay tuned.
Taking care, patience or sometimes just to hold our hand.
A message from the Caribbean Child Support Initiative, a program of CARICAD with support from the Bernard Bandler Foundation.
Take good care of the children.
A picture is worth 1,000 words. Got it? Taking care of us can be so easy.
Take good care of the children.
Welcome back to our continuing discussion on the Roving Caregiver Program. This program has been implemented by the Caribbean Child Support Initiative and now operates in Dominica, Grenada, St. Lucia, St. Vincent and the Grenadines, as well as Belize and Jamaica. It's a very important program that has demonstrated without any doubt a clear impact on child development, parenting skills, youth employment, crime and delinquency, and also shows a benefit for early childhood and ongoing educational results. It's therefore very important for us to discuss sustainability of such a really, really important program. We'd like to introduce to you now Anne Shirley, who has joined us. Anne is a financial analyst who has worked across the Caribbean. And we continue to welcome Dr. Didacus Jules as Registrar and CEO of the Caribbean Examinations Council, and Mr. Milton Lawrence, who is the CEO for ECIC Holdings, a company that is owned by 10 indigenous banks in the region. If we were really talking about something that has such a profound impact, long-term influence on social and economic regional results, how is this going to be sustained? Is it a matter, Mr. Lawrence, for governments only, or are we going to have to look at public, private sector, and maybe even civil society partnerships?
Well, I think you're right. Partnerships are key in this area. As Dr. Jules pointed out in the last segment, this is not new, this is not rocket science. There's a lot of this going on. There are a number of initiatives that probably sometimes contradict each other, overlap each other, and I think it's obvious to all who look that in fact there's a fair amount of duplication and to some extent wastage of resources. I think that this issue of intervening with the 0 to 3-year-old kids, especially the vulnerable ones, is so important that we now have to look more carefully at how we provide resources. And I think the partnerships between government and the private sector and civil society are key. In several of the islands that you've mentioned, there are in fact efforts at partnership taking place. Yes. And I think what we need to do is to refocus our efforts and to ensure that the resources that are available are utilized in a much more efficient manner.
Yes.
And in fact, the CCSI experience has been a full documentation of what is possible. Yes. Because you have had in 2008, for example, in the 5 territories you mentioned, there were 2,280 children benefiting from the program, guided by 151 rovers. Yes. But what is interesting from the snapshot of the results, this group of rovers have had about 2,200 meetings with parents. They've had 137 community meetings. And really encouragingly, the financial indicators of the project. In Jamaica, it costs about, rounding out the figures, about $60 US per year for the roving caregivers to deliver to each child.
Can you say that again? That sounds very low.
60 US, it is very low. 60 US as compared to 900 US for daycare provision for the same child per year.
So the cost benefit is clear.
It is very clear. In St. Lucia, it costs about 600 US per child in the roving caregivers. Notice the costs vary across territory for a number of reasons, but in Jamaica, because there's a much better integration of the program with other modes of delivery, it makes it possible to have it cheaper. So 600 US in St. Lucia. The daycare provision costs 1,000 US, and private preschool costs 1,600 US. So I think, you know, it's very evident that the CCSI has developed a model that can very cost effectively and importantly for governments in these difficult times, deliver services that are vital at significant cost benefit.
What intrigues me is that I've never heard of a program that will impact children, I mean, almost from the womb to 3 years of age. Youth, because a lot of the roving caregivers are youth who find employment. Parents, communities, because the caregivers are interacting at a community level. So it is really a wide cross-section, deep, and therefore if the benefit in terms of cost is as you say, then how can governments really turn away from such a program? We have seen in most of the islands that in fact governments are now partnering to deliver the program. Is this something that we need to now expand, and how do we include other participatory organizations?
But I think this is sort of the issue now that everybody's looking at, is the way forward.
Yes.
And the couple of things for the private sector and the governments, I think what has just been said, that